Chairman.
That's, would you repeat that last statement you just made, Senator? I'm sorry for catching you off guard there.
That's okay.
Sometimes
I'm just referring to the bill. As it states, there are consequences to the state if it does not implement or enforce the federal reform provision. What are those? It's clarification, it's accountability, and saying what do we do or what do we not do? What are the consequences to the state?
So the bill says that, but we really don't know what the consequences are, other than it's going to affect the reimbursement from Medicare on certain procedures.
No, ma'am, we don't do it that way. I'm sorry. We have to get the chair's permission to speak and respond. So
that's my last question.
Senator Burnett, you recognize.
I'd like to know exactly what the cost and consequences are to the citizens of Arkansas and providers of medical care. What are the dollar figures that are anticipated to be lost if we invoke what I perceive to be the states' rights bill? And by the way, I point out that I am totally and completely opposed to federal mandates to state government. And I'm also very much in favor of transparency in government. I think the citizens have a right to know what we do as legislators, what our agencies do, and their spending. But on the other hand, this just seems to me to be a collateral attack on a federally mandated bill that will have serious consequences to our citizens and our medical providers. And I want to know what those costs are.
Well,
Is that, Senator, you want to direct that question? Okay.
I'm sorry, Mr. Chairman.
I know how attorneys are.
That's just me. I want to make sure that I understand your reference to states' rights, because as I understand it, this is not a states' rights bill at all. And let me explain what I mean by that. You know, everybody knows that we have a right to vote, but I think also everybody knows that states have to pass rules that ensure and protect that right to vote. Like, for instance, a system of voter registration. I don't think anybody really could argue that a system of voter registration has anything to do with blocking someone's right to vote or blocking democracy or anything like this. Voter registration is just a system that makes sure that the underlying right to vote is protected. Similarly, when we have this federal health care reform, the states are necessarily going to have to pass all kinds of regulations to make sure it works correctly. I view this as being part of that you're making sure that you inform policymakers and the public of the details of the system, so that, for instance, policymakers can plan appropriately. But to say that it's a collateral attack on federal health reform, I think that's hard to justify, just because I see it as a way to inform policymakers about the real costs of the system.